My name is Solveig Overby, and I just wanted to alert you that on Monday night, the City Council is going to be doing a work session about the so-called Memorial Block development, the 3 acres of prime downtown Burlington real estate that 2 developers have been given a sort of an exclusive to develop. But if anybody wants to get information about where that's going, it's Monday night at the City Council meeting, and I have a very large concern about the giveaway of that 3 acres of prime downtown Burlington land. So I've been proposing that we make sure that it gets done as a long-term land lease. And the Kara Al-Nasrawi, who works with the mayor, has said that that is a commitment. They will do a long-term lease, and they'll train people about how that works. It's already been done with Beta Technologies at the airport. So they have a long-term lease for their business, their property. So we have to ensure that we do not give away that 3 acres of prime property in the downtown of Burlington to these 2 developers.
Where is it called, Solveig?
It will be at the City Council meeting, Contoy's Auditorium.
Where's
They
the
start
property?
At 6. The property is the entire block between Memorial Auditorium down to the corner across from Mr. Mike's Pizza, all the way up to where the Congregational Church is, that whole section. It's 3 acres, and the city owns it. There's one section that has got that tattoo building in there that the developers have an option to buy, and so they feel like they have locked in their ownership of that whole thing. So it's really something that's been really a big concern of mine, and I'm hoping it's a concern to other people. So the least we can do at this point, I think they've been giving it away. It's going to be the giveaway to the developers. However, we can insist on a long-term land lease, similar to what they did for Beta Technologies. So we have 75-year lease, and then the city retains that ownership, because we don't know what the city needs in 75 years. So that's my pitch.
Hi, everybody. I'm Megan Humphrey, and I live in Ward 2, and I have a couple of quick announcements. One is I wanted to repeat what Jess had said. In a week, there's going to be a community dinner here for folks 55 and older. And so thanks to the One Good Deed Fund and lots of the folks who do the dinner tonight, local restaurants are pitching in, and the Heineberg Senior Center. And there's also going to be a gift table, so people have been donating things for that. So on these sheets, on some of the tables, and up at the front where Monica is, there's more information if you know of anyone who wants to sign up for it. And we're hoping people will RSVP ahead, because we're planning on at least 200 meals. So that's one thing. And I have started making, some of you in this room have helped, I've started making craft bags. It's helping to get rid of some of the things in my studio. And lots of folks have been helping with donating things and stuffing the craft bags. And I'm getting them delivered to all kinds of nonprofit organizations and centers around here, homeless shelters, health centers, places like that, a lot of food shelves. And so if anyone has art supplies to donate, they really need to be new or like new, please. And if you want to help deliver them or stuff them or donate money to fill in the gaps of things that I don't have that we need to purchase in bulk, that would be great. Please see me later. Thank you.
Hi, everybody. Mila Grant. I live in Ward 2. I'm your Central District City Councilor. And I know I'm ruining your holiday season, but Town Meeting Day is just around the corner in March. And we had our Progressive Caucus last night, and Gene Bergman is running for re-election. Yes, he is a warrior. We need him. And we had, I know this is a Ward 2 NPA, but I know you Ward 3 people like to sneak in and watch. We have two candidates, two very good candidates that are interested in running for Ward 3. It was recorded, the caucus was recorded by Town Meeting TV, so you can watch it and you can hear the nominating speeches and you can hear the candidates start to talk. So it's just a reminder that during these times, we really need people to be involved. And being involved can be as little as a half an hour. You do half an hour, you write out neighbor cards. You do half an hour, you do texting. Maybe you live in a place that's a high traffic area and you'll take a lawn sign. But it's really important that, quite frankly, we hold the line, because we are dealing with some things on city council where we're not really dealing with Democrats, we're dealing with Reagan Republicans. We will be talking about the Apartheid-Free City Resolution, which Council President Travers has already said publicly that because he's a council president, he will not allow it to be put on the agenda. So this is just really extremist to me. This is not democratic, and it does not take into consideration all the people that live in our community. I understand his personal fears for himself and his family, but last year, because I wore a keffiyeh, I was harassed in ways that I have never encountered. I was called really horrible things. I still deal with some of this. We had 3 Palestinian students shot in our city. The lack of empathy is astounding. So I will just leave it there. But thank you very much, and please keep these things in mind.
Hi, everyone. My name is Monica. I actually live in Ward 7, but I come here and volunteer for your wonderful community dinner. I just want to make an announcement that on Sunday, December 21st, there is a New North End holiday market, and it's at the Miller Center. And it happens, I think it goes from 10 to 3. So if you need any last-minute Christmas gifts, holiday gifts, come on up to the holiday market in the New North End, and it's organized by Melissa Kane, and I forget the other person. So, but she's done ones in this building before, and also in the New North End in the past. So think of it.
Message from Jess from the kitchen. There's a lot of food at the front table here. If people want to take it as they kind of leave, feel free. Anyone else for community forum? Okay. Had a schedule.
Actually, I should probably put a pitch in. So, I'm Charlie. I live in Ward 2, but I'm helping to organize the new Ward 3 polling place. So for whatever reason, we need a lot of extra help at the Ward 3 polling place, which at the moment is going to be held at the Sustainability Academy at Lawrence Barnes School, but it might change to Contoy's Auditorium, but that seems like that's a fading plan. So if people are interested in working at the polls, we're going to be organizing that, and I'm going to put a lot of emphasis this year in March, August, and November to try to train people who will do it for the long term. So I'm looking for people who are interested in doing it for a couple of years or 4 years. So there's an opening for a ward clerk, which runs the whole thing, and 2 inspectors. So there's a lot of room there. Plus there's a lot of room for assistant poll officials, which are usually the people that check you in when you work at the polls or they're at the tabulator on the way out. So you're going to be hearing more from myself and other people about looking for workers for the Ward 3 polling place. Now, if you live in any other ward, you can still work at the Ward 3 polling place. You just have to be a registered voter in Burlington. So just bear that in mind. We're looking for people to work at the polls for Ward 3. Thank you.
Okay, last call for community public forum. Okay, then I guess we'll move on to our next agenda item, which is the community vote for Apartheid-Free resolution. For those of you who were here last meeting, this was introduced. We went over it. We got to ask questions about it. It's going to come up on the screen here. Unfortunately, we don't have physical copies for you to read, but I can read it. And we don't have too much time for questions because we did go over it last meeting, if you all remember. But obviously, if there are urgent questions, we can address those. We've got some people here that can answer those questions. So I will read this bad boy. Okay. And it's very small. And just for background, this is just a vote, I believe, to put it on the ballot, to send it to City Council to say, we want this on the ballot, so Burlington can vote for it or vote not for it. More background, as we learned last week, it was supposed to go on the ballot 2 years in a row now. Each time City Council has said, we see that you voted and you want it on the ballot. We're not going to put it on the ballot. So perhaps the third time's the charm. We'll see. Here we go. Whereas for 2 consecutive years, petitions were submitted to place the following non-binding advisory question regarding the Apartheid-Free Community Pledge on the 2024 and 2025 Town Meeting Day ballot. Shall the voters of the City of Burlington advise the Mayor and City Council to adopt the following pledge? We affirm our commitment to freedom, justice, and equality for the Palestinian people and all people, and we oppose all forms of racism, bigotry, discrimination, and oppression. And we declare ourselves an apartheid-free community. And to that end, we pledge to join others in working to end all support to Israel's apartheid regime, settler colonialism, and military occupation. And whereas, in both years, the city verified that the petitions contained a sufficient number of signatures to meet the requirements of 17 VSA 2642 and Burlington City Charter 6, 5% of the registered voters of the city. And whereas in both years, the City Council voted to block the aforementioned ballot question from appearing on the town meeting day ballot, and whereas the City Council has discretion to include advisory questions on the ballot, and exercising such discretion, quote, furthers the council's ability to balance the efficient transaction of city business with the provisions of a local forum for discussing state and national issues, and whereas there is abundant precedent across Vermont for placing non-binding advisory questions about national or global issues on the town meeting day ballot, including a call for a nuclear arms freeze passed in 155 Vermont municipalities in 1982, a vote opposing the Patriot Act passed in Waitsfield in 2003, a call to withdraw U.S. troops from Iraq in 2005, and a measure opposing the basing of F-35 fighter jets in Burlington passed in 2018, and whereas similar petitions to place the Apartheid-Free Community Pledge on the 2025 Town Meeting Day ballot were respected by municipal officials in Winooski, Brattleboro, Newfane, Thetford, Plainfield, Montpelier, Vergennes, Bristol, and Weyburg. And whereas in April 2025, the City Council unanimously approved a resolution for protecting free speech on Palestine. Whereas the precondition of responsible and accountable local governance is free speech and democracy, now therefore be it resolved that the Ward 2 Neighborhood Planning Assembly urges the City Council to place the aforementioned non-binding advisory question regarding the Apartheid-Free Community Pledge on the 2026 Town Meeting Day ballot. So that's what we're voting on. Just a reminder, please only vote if you're in Ward 2. Please and thank you. Can I get a motion to begin the vote? Great, great. Okay, all those in favor of Ward 2 passing this resolution, just raise your hand and please leave them up, as I gotta count these. Correct. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 24, 25, 26, 27. I got 27. Oh, 27, 20, that would be 29. Yes. And all those opposed? All right, that would be a pass. Resolution passes. Yes, for the minutes, good idea. That's 29 for and 0 opposed. Thank you. All right, next on the agenda, the Overdose Prevention Center, and do we have Teresa here? Oh, there you are. Hi, nice to meet you.
Nice to meet you.
I'll give you this.
Thanks. Jess Kirby was going to join me, but I'm going to go ahead and start.
Write down if you'd like, or stand. Just make sure you introduce yourself.
Hi, everybody. My name is Teresa Vazina. I'm the Special Assistant for the Overdose Prevention Center Implementation Project at the Mayor's Office. Jess Kirby from Vermonters for Criminal Justice Reform will be joining me shortly. She's just running a couple of minutes late. It's actually really nice to be back. We've been here a couple of times previously. So tonight we wanted to share a little bit of an update about where the project is at, and also ensure that you all were aware of the community survey that is currently live until December 15th. And I think they're going to maybe put that up on the screen, and it's also on Civic Clerk for you. It also is on the city website on the mayor's page under the Overdose Prevention Center. So for those of you who may not know a lot about the project, that's a really great page to go to if you want to learn more about the project in general, and also receive updates on where we're at with the project. But for tonight's focus, we really wanted to talk about the community survey, a little bit about what it is and the intention for the survey as it relates to the project. So the service assessment is one of the core requirements before the city can open an overdose prevention center, and that requires an extensive amount of community engagement and also gathering of information. And so this community survey is sort of the launch of probably several months of community engagement activities. It's an anonymous survey. It takes anywhere from 5 to maybe 10 minutes, depending. And it is been developed specifically to meet the requirements of the service assessment. And so the questions that you'll see within the survey are required questions of the health department. So these are questions that they want us to ask the community, local stakeholders and community partners. And it's the first phase of the survey is this anonymous survey. And then the second part is that the group that we have contracted with, PIRE, that stands for the Pacific Institute on Research and Education. They will then be analyzing the data that comes from the survey, and from that they'll conduct one-on-one interviews and focus groups within the community, and hopefully those will begin in February. From there, we will hopefully have a final report in March, maybe a little sooner if everything goes well. This is just one part of the engagement strategy. So we'll also be doing community listening sessions and other forums, as well as coming to NPAs across the city. I want to share this with you, but I also wanted to make sure we left plenty of time for questions. So I think that's always the most important thing for me, is to be able to answer questions for you. And I see Jess walking through the door now. Hi. I'm not sure how you all handle questions, but I guess you might have a microphone to pass around. Oh, awesome. Thank you, Nora.
Anyone with a question or comment, query, what have you, just raise your hand. Oh.
Is it possible to say what the questions are now, to tell us now?
Oh, I'm not prepared to tell you all of the questions now. There's a lot of questions. I can give you a general idea of the questions.
Sure.
So I'll talk more about the key sections of the survey. So one part is going to be about where location, like where might you like to see the location. Some of the other questions are going to focus on the kinds of services that are going to be made available at the center, what your feelings are on the benefits of the program, like what do you think are some of the benefits of the program being here, and also what are your concerns, as well as what are the ways that you might like to be engaged through the process. So there's, it's really hard for me actually to go through the full list of questions. I really honestly came very unprepared to do that. So I think that if you just take a look at the survey, you can scan the questions before answering them. So you don't have to answer the questions to get to the next question. You can actually review the questions before fully answering them. I'm sorry, I just didn't come prepared to answer that question.
So, Teresa, not to interrupt, but just, I scanned the QR code. I can give a quick,
That'd be awesome, Nora, thanks.
Not read every question verbatim, but just a quick overview. You can, there's a couple pages where you click through just reviewing what an overdose prevention center is and some of the science behind it, it looks like, in support of it as a meaningful tool. And then questions, they're on a scale from 1 to 10 sort of thing. Strongly disagree or strongly agree. Indicate how helpful you think an OPC will be for Burlington. What your priorities are in terms of outcomes if Burlington were to have an OPC. Yeah. But super easy to get to if you just scan the QR code.
I think the most important thing that I'd like to share is that this survey is not the end-all be-all. It is the one very small part of the way that we'll collect information and the way that the community can share their thoughts and input during this process. It launched on November 6th and is open until December 15th. If you go to the city website, I believe this code will bring you there. There's also an on-demand webinar. When we launched the survey, we launched it in conjunction with an educational webinar that we brought in some local and national experts to share a little bit more about OPCs and what's currently happening here in the US and some of the current data. So that's available on the website. And I think that some of the feedback that I've heard so far since we launched the survey is folks were concerned that maybe this would be the only opportunity that they would have to share thoughts with us, but that's not the case.
Are you going to be able to get this survey information from the population on the street that we are hoping to assist? on paper form or some other thing, like direct outreach to the people that are the population we hope to reach?
I really love that you asked that question. There was actually a separate survey specifically geared towards people who use drugs, towards people who would potentially utilize the service. And I'm actually going to let Jess speak about that because these surveys that were done were actually done in person by the staff of Pyre so that they could read the questions to folks and make sure that they understood the questions. And they went a much more in-depth with folks who would be utilizing the service. It is critically important. It was actually the first thing that happened were the surveys with people who would use the program. They also will have another opportunity to do one-on-one interviews and focus groups, and those also will begin in February. But I know Jess was a part of that, so I want to give her a chance to talk more about it.
Thanks. Thanks for asking that question. First, my name is Jess Kirby. I'm the Director of Client Services at VCJR, and I'm a person with lived experience myself with opioid use disorder, and at a time in my life I really could have benefited from an overdose prevention center myself, and it was really important to me and to Teresa and everybody involved that we really had like an in-depth process for people that are in need of an overdose prevention center and likely to use a site, we hope. And so we really wanted to make sure that we were thoughtfully about that and wanted to ask more in-depth questions of that population. We want to make sure that we're building this program in a way that incorporates feedback from them, and that the idea is to have a program that they'll feel comfortable at, that they'll use, that has services that will really benefit them. So we had a specific process that we did first with much more in-depth questions, for that population that was, from everything from like, how do you think you would get there? How far do you think you would travel? What area would you like to see it in? What components of the program would help you feel safe? What will increase the likelihood that you would use a program like this? And just everything from that to like, what services would you use there? Do you think you would utilize other services or just use consumption services? Really getting into depth with the population that we're trying to target, to really hear from them what they want and need to see, and what's likely to reduce their risk the most and make them feel comfortable to use the site, and wanting to make sure that the best we can, we incorporate everything that people feel like they need and want to see there. So we surveyed 50 people from around Burlington. Those surveys were incentivized. All of the people that were surveyed were people who are currently using drugs, either injecting or smoking drugs, for the most part. People who have had overdoses, the vast majority, just making sure that we were targeting people that are at risk for overdose and likely to use an overdose prevention center in the Burlington area. And on top of that, so we have that information, which was going to be extremely useful. We're also, like Teresa said, going to be doing one-on-one interviews and focus groups with that population too. So we wanted to really make sure we did our due diligence there.
Is it possible that on an anonymized version of their thoughts about the prevention center could be made available to the public? Because I think that might be useful information to people that are worried about this situation. And I really think it would be helpful that they actually heard the words of the people that are a population we are trying to help with the site. Thanks.
I love that idea. Yeah.
I will say that the service assessment will include the data from that set of those data points will be included in the final report as well. But we're also looking at doing some other type of ways to share. I think it's really important to help to humanize this project. We'll be working on a video project as well as some storytelling work, and hopefully a beautiful art installation that I'm really excited about. Really trying to think outside the box in ways that we can help highlight the voices of people who are actually actually the most marginalized and who would be using this service. So.
Sorry to talk so much, but I was going to add, you know, the film "Love in the Time of Fentanyl" is a book that is a film that actually was shown, and we had a discussion. Chris Heasley sort of facilitated that, and that might be something to also help people see that and see how it is the humanization of the situation and having a social community, which is very important for them to have. So that I don't know, I just want to market that film if it's possible for people to see that haven't seen it.
Yes, thank you. Or maybe have our own version here in Burlington.
Yeah, I was thinking that too. Maybe one day we'll be making one of those. Yeah. No, I'm sorry. I was just gonna say I love that idea. I spoke on a panel when that was shown, and you know, it does absolutely humanize this so much, and you know, maybe it's just a great idea, and maybe there's an opportunity to have another showing of that, like as we're, you know, we're in a different place now with making OPC a reality, and you know, it's a really important time to be helping people you know, see this perspective, and maybe we do some kind of an event involving that film again and invite everyone from the community. Yeah.
Hi, my name is Becky Rabin, and I live in Ward 2. And I have, it's actually a two-part question. How influential is the results of the survey to the likelihood of the OPC becoming a reality?
This is one of the things that I've got a little bit of feedback on, and the survey is kind of definitely, we're moving forward with the project. And so it's not so much about if the OPC will open, it is about like, what do we hope to see happen and be part of the OPC. The decision has already been made pretty clearly through our Act 178 through the Vermont Legislature, but also contracts are now in place, and we have a pretty clear project plan and path forward. So hopefully what this is going to do is help to inform the early stages of implementation.
That's great news.
Yes.
And I guess the follow-up part is, I guess I would encourage people before they do the survey to do a little bit of reading on the website, just to, you know, frequently asked questions, or just some of the not unlikely concerns that people might have. There are other case studies that have brought clarity to that situation, and that they're how beneficial they are, really. So I suggest educating yourself.
I really appreciate that. One of the things we talked to lots and lots of folks, and I met with a group of community members from Ward 8 last night at the library, and then I also was at the library tabling today, and consistently what I'm hearing from folks is that when I'm chatting with them on a one-on-one, they're learning for the very first time that the Overdose Prevention Center is not just a place where people will use drugs under supervision. There's this sort of like media image that I'm hearing from a lot of people, that the only thing they think of when they hear Overdose Prevention Center is this visual of people sitting at the stalls, right, at the tables injecting drugs, and that's all that happens at these centers. And that is the furthest thing from the truth. And so I think I'm realizing that really, like, talking more about the other services that will be available at an OPC and will be actually rolled out well before supervised consumption are services like wound care, medical care, case management, low barrier access to treatment, recovery services, support groups, ways to analyze the drugs that you may be using through drug checking services, and also relationships, like building those relationships and creating a social space, a community space for people. And so we just don't want to lose sight of all of the other wraparound services that are going to be available before consumption services, but also during. And then with consumption services, we're really looking at how we're responding to an overdose well before people are getting to that place of needing to be Narcaned, right? So that's sort of, it is an important component of this project, but there's still a lot more to it. And I've been really surprised to hear how many folks didn't realize that all of these extra additional services will be a really big component of the program. So I just want to clarify.
I just wanted to add on what Teresa's saying, now that, things are becoming, closer to becoming a reality with having an OPC. We've been talking to clients for many years about this, but, we're talking to people a lot more because people are hearing things in the community, and they're like, this is really going to happen, right? Like, we're going to be able to use a site like this? And I'm like, yes. And, I just want to, drive home that, I think sometimes we hear things in the media about like small reductions in overdose deaths, which is great, but just for people to understand that there are still a lot of people dying of overdose. We've lost a couple clients in the past 2 weeks. I've responded to overdoses that were really severe in the past few weeks. Personally, every day we hear stories of people having near-death experiences with overdoses and, narrowly escaping it. I was visiting somebody in the hospital yesterday who's been in the hospital for many months because of some serious harms that happened to him during an overdose. Will impact his life forever. Just it's something that's still really, really needed. But, there's so many things that I think people don't think of in terms of how much this will make a change for people. All of the services that Teresa's talking about will be there, but I think some people could say well, there are services in the community anyway, but this is doing it in such a different way that's going to make such a different impact for people. I was meeting with somebody yesterday, and we were doing an intake into, we have a contingency management program, and we were doing an intake into that, and we were talking, and there's questions about overdose, and when was the last time you had one, and we were talking about his recent overdoses, and so it got us talking about the OPC, and then he was like, wow, so really, I could come here and do an appointment and then, not have to leave and go do what I need to do for a while and probably never make it back that day. I could just step away for a minute, and do that and then come back and pick up what we were working on. And I'm like, yes. And he's like, I can't tell you for me and for how many people how much of a barrier needing to go use something because I'm starting to feel withdrawal symptoms, because whatever I've used recently has started to wear off and I'm distracted by, the feelings that I'm having related to maybe coming down from the drugs or withdrawal symptoms that are setting in. And I have to leave. And even though I really want to make that call to treatment with you, I want to finish this application for housing, I really want to go to Valley Vista and make that call, but I have to go do this first, Jess, and I'll be back. And people don't make it back. And they have so many competing needs. They don't know where they're staying that night. They don't know where they're eating that night. Someone stole their backpack on the bus and their phone was in it. And, just a million things that happen to people in a day that they intend to get back and they don't. And before you know it, 3 weeks has passed and we're back at square one and you come in and you start over, and he's like, the idea that you can, just not that we can just treat that like it's another need that I have and I don't have a safe way to do it. I'm going to go do that and come back and we're going to make that call to Valley Vista. People are going to use this site to use drugs that they have, obtained previously, and then they're going to come and make a call to treatment, and make a call to the methadone clinic, or, jump in on a peer support group that's going on, or see the medical provider for a wound that they have. And being able to just do that all in one place and not have to have this huge barrier in the middle of needing to use drugs in another place that maybe is really unsafe, and maybe they never make it back because they don't survive. That can happen too, and has happened. But, he was just mind blown by the idea that he would be welcomed in a way, and that his safety is prioritized above all. And we're gonna, you'll do what you need to do, and we're gonna pick back up on what we're doing. And the idea of how much that would open up opportunity for people to, continue making progress on the things they want to make progress on while they're there that day. And it was just really cool having a conversation with somebody who was in the moment realizing how like game changing that could be for him and his peers. So it was really cool. Yeah, it's fun to share that with you guys. Yeah.
I think it seems like that might be all the questions, and we just want to thank you. Like I said, this is our third time that we've been welcomed here to Ward 2, and we'll continue to come back, and as the results are coming back, and we'll want to come and share the findings from the service assessment, and we're also would love to probably hold a couple of listening sessions throughout the community, and we would love to be able to come back to Ward 2 to do that with you all. So expect to see us again.
So this will be the encore. Have you gone to all the other NPAs?
We have been to all the NPAs except for Ward 8, which is why I met sort of individually with community members who live in Ward 8. So that's why we did this sort of like non-NPA meeting. They don't have less meetings. It's been a little more difficult, but yes, we've been to every NPA. Most of them we've been more than one time, and we hope that this will be an ongoing place where we can connect with the community. Yeah. Oh, and if you all have ideas of other places or places you'd like us to be, if you go to the city website, there is ask a question or make a request. You can just make a request to me. I'll get that directly. So if there's a group or a place, I'm going to go. We're going to be there. Yeah.
All right. Thank you both so much. That was great. Next, we have our steering committee budget that we are going to, I'm going to present to you and we're going to vote on. I believe we have that so we can get it up on the screen, and I'll kind of explain. It's nothing crazy, but like Jess said, so we get allocated some money from the city to run our meetings. That's getting the word out there that we're doing this. Some of it goes to the community dinner. Some of it goes to our door prizes that some people are filling out. If you haven't put your name in, put your name in. Oh, whoops. Okay, working on getting our budget up here. One moment. Do. Okay, it's coming up momentarily. And I can kind of talk about some of the items as it's slowly getting up on the board here. Sorry, thank you. So it's going to be put up here, but so we're going to be voting for to approve our 2026 budget. We've put it together as a steering committee and said, this is how we think we should spend our money, but we do need to, get it approved by you folks. All right. So in total, we have $2,630 for 2026. We are proposing $1,000 go toward some community dinner sponsorships. Any questions about this, I could try to answer. Jess is still here and might be better. But, you know, we have our donations. We like to, you know, no one has to pay. We want to keep it that way, you know, a pay what you can kind of situation. But we do need some help doing that because numbers have been down. So we're hoping to allocate about $1,000 for that. Like we were hearing about from Janet, in the kitchen, the food processor broke. So we're hoping to get a new food processor so we can keep making good dinners. And I believe it sounds like, I think Jess mentioned, we also might need a new immersion blender. So that might go on there also. Outreach, 1,000. This is tabling and, you know, things like our front porch, well, actually front porch forum is free, but posters, stuff like that. I believe outreach we did one year was at the Ramble, I believe. We are at the Ramble this year, yes. So stuff like that to make sure that, you know, everyone knows about this. This is a really great thing that we do, providing these meals to people, and this is a really good way for people to get information about what's going on in our community. We want to be able to reach everywhere in the Old North End, so that's the number we're proposing for that. Rooms and facilities, so some arts and crafts table supplies, $30. Meeting support, our Zoom subscription, door prizes, everybody loves those. And then that leaves us about $370 as the year goes on in case anything comes up. We'll probably, like I said, need to add that immersion blender if anything else happens in the kitchen. Yeah, we like to leave a little cushion, but does anyone have any questions about our budget? Oh, got a question back there.
So Grace, is the dinner sponsorship, does that just mean the cost of the dinner?
Yes.
Okay.
So that's, you know, kind of helping support, like I said, not everyone's able to pay. Oh, Jess, do you want to? I feel like you'll be better at this, yeah.
No. So the costs for the community dinner cover ingredients. So we get donations on site that usually sometimes will cover the cost of ingredients we need to purchase, but more often not. And we've also noticed that as we've seen an increase in people coming to join the dinner, which is amazing, we're having to cook a lot more food. So the donations thereof don't come close to covering the ingredients that we purchase. And so part of the sponsorship would be to help cover ingredients, a few items that we need to purchase. And then also, it could allow us to do more guest chefs. So when we have guest chefs, we give a stipend to that chef, and Mascoma Bank has supported that in the past as well. So, thank you. It was just of course, sponsorship. Yeah. Good. Thank you.
Yeah, that made me way more sense than what I just said. Okay, any other questions before we vote? Okay. In that case, motion to vote.
Ward 2.
Oh, yes, like I said before, please only vote if you are a Ward 2 resident. Right there. That's a motion. Excellent. All right, in that case, all those in favor of passing our proposed budget, please raise your hands and keep them up so I can count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and I'll be 21. Do we have any on Zoom? That's 22. All those opposed? Phew. All right. That's
Thanks,
0
everyone.
for the minutes. Okay, great. Moving right along then, we have our listening session with our state legislators. We got one. Come on up. I was told more would be here. Okay.
Great. Hi. So my name's Abby Duke. I'm a representative for the district called 17, which is the part of Ward 2 that is west of Park Street and west, the west side of Park Street and west. So, and Jill Krawinski is on her way, so she'll be here. But I can start talking until she gets here. How do we want to do this? I mean, I could talk, or you could ask questions. What do you guys want to do? Should I sort of give you a little bit of an overview?
Little bit of both.
I'll give you a little overview, and then, but feel free to jump in with questions and the like. So the session starts in January 6th. So we're a part-time citizen legislature. So we serve full-time, which is we go to Montpelier 4 days a week from the beginning, early in January until early in May. And so during that time period is when we're working on all of our work. I'm in the House of Representatives, which is 150 people from around the state. There are 11 representatives from Burlington. My district has just one representative, but the other 5 districts in Burlington have 2 each. We're separated into 14 committees. So we have the most work we do is what we're looking at on our committees. So I'm on the Committee for House Commerce and Economic Development. So we work on issues dealing with labor, economic development, consumer protection, banking, insurance, except for health insurance. But then we also work on a lot of other things too. So coming into this year, is kind of fraught. We're all, things are starting to move quickly as we're trying to get a handle on some of the big issues that we're going to be working on. Number one is the budget. The state of Vermont's budget is $9 billion, and $3 billion of that is federal money, which is, so imagine that, $9 billion, a third of it is coming from the federal government. The bulk of that is for Medicare, but it's also for the transportation fund, and for some other places in state government. Last week, we had an all-member meeting where we had presentations from the fiscal office and basically about the fiscal health of Vermont. How is our revenue? What is, how are things looking for the coming year? And one piece of good news is revenue is on track for what was expected in general. However, a big concern is we had a presentation from a woman from an organization, the acronym is FFIS, and it's basically the organization that advises and works to give information for federal funding to states. And she spent about a half an hour saying, I don't have as much information as I normally have. I'm not really sure what's going on. So that I think we're in for a difficult budget year because we all know what's happening in the federal government, and there's a lot of uncertainty about some of that federal money. I think especially looking for next year, when things are really going to impact it. So the budget, I think, is just something that is going to be really concerning, and we all know the pressures that a lot of our local nonprofits have with reduced federal funds. And we rely on many of our nonprofits to take on the role of supporting our most vulnerable citizens, and often taking the role of what government really should be providing. So it's all very concerning. Just put it that way. So the budget is the first thing I want to talk about. Second thing is healthcare. Healthcare is driving a lot of our challenges with the budget. Vermont has the highest. We spend the most on healthcare in the country per capita. Our insurance, actually, that might not be exactly right, but our insurance rates are the highest in the country. We spend $10 billion on healthcare, our little state of 650,000 people. There's a lot of sort of background behind that. But that is, and Jill is here too, so she'll have more information as well. So healthcare, whole variety of, we'll be working on health issues with healthcare to try to help drive the costs down. Housing, something that is we all understand some of the issues with housing. We don't have enough housing. It's too expensive. A lot of our housing is bigger than we need it to be. There's a mismatch between the size of housing. We've done a lot over the last few years on housing, and we need to be doing a lot more. So I will say one other thing about housing is that is something that my committee spent a long time working on, something called CHIP. Does anyone know what CHIP is? You know what CHIP is, all right. So CHIP stands for the Community Housing Infrastructure Program. So it is basically a project-based tax increment financing system that will be launched in January, which will allow developers and municipalities to work together to build infrastructure for housing by borrowing against future tax revenue, but doing it in a way that is like project by project. So we have high hopes that that is going to make an impact. But this is, that's a long-term solution. We also need to be thinking, about more short-term solutions. And the final thing that is, looming, and we're going to be putting a lot of time into, and I'm going to let Jill talk about more as well, is education. We started the beginning process of education reform last year, and now there's been a report from a redistricting task force, and we're going to take that and figure out what those next steps are. And so that is a quick overview. I did a quick overview of these topics. We can go deep for hours on any of that. So I'm going to let Jill kind of give an overview of who she is and what she thinks are important, and then we can just open it to questions, is kind of what I was thinking.
Absolutely. Thank you so much, Abby. Sorry, I made the poor choice of walking here, and so I am frozen and behind. But it is great to be here. So my name is Jill Krowinski, and I represent Chittenden 16, which is the House district that represents part of the Old North End in downtown. I am also the Speaker of the House, so not only do I work to represent Chittenden 16, but I also serve the state in that capacity. And I think that Abby did a good job laying out some of the challenges and opportunities that we have ahead of us this session. As you know, with our state budget, we are facing some significant cuts from the federal government. We are seeing that in many places, most clearly in housing and healthcare and LIHEAP, ways that we can fund heating for those who need help, and food security in many other places. And it's not just in this upcoming budget, it's in the following budget in 27 as well. So we need to be really creative and thoughtful as we go into budgeting for this year. How can we make sure that we are set up for a good place to start in the following year? And that's going to be really hard. So I do want to emphasize that the challenges with the budget are real, and there will probably be 5 or 6 things that happen between now and January or February from the feds that will impact our budget that we don't know about now, that we will have to respond to, and it will not be good. So we are going to work really hard to ensure that our government are providing the core services that we need and we expect to make sure that people have what they need to thrive. And it's going to have some tough conversations about where do we need to cut, and how do we prop up things that we know have a really good return on investment. And so, the budget keeps me up at night, and I also think that there's possibility for politics with the governor to use the budget as a way to keep us there to do other things with his veto. And I think that's something for us to be thinking about and aware of, because we have seen that in the past. So for me, things that are really important for this session: housing, healthcare, workforce development is going to be really important. We've done some really great work providing free and low-cost education through our state college system to Vermonters across the state. When we knew that we had a problem and a challenge with traveling nurses and the stress that was putting on our hospital budgets, we invested in programs in our state college system to help create pathways for nursing opportunities. And now we have like a great nursing pipeline that's happening. And it takes time, but we're seeing really great positive results of that. We need to continue to think about other opportunities or what career opportunities we need to lean into to ensure that we have the workforce to help us with what we need, thinking about plumbers and electricians, things of that nature. It's going to be really important. I also think that it's really important for us to be doing oversight and accountability of what the administration is doing with the programs and budgets that we have passed. It's really disheartening to have someone show up in a committee to testify on a program that we passed 2 years ago in a budget to hear that it hasn't been implemented yet and it hasn't been stood up. And again, in a year where we have tight budgets, we need to know and understand what's working and what's not working. And so that is a place for me that I feel like we really need to lean in. Last legislative session, we did a lot of work on health care to help lower prescription drug prices, to also help support our rural hospitals that so many of them are in the red. We gave the Green Mountain Care Board some more tools to help them. We need to continue that work. It is clear the cost of health care is just untenable for so many families, and there's only so much that we can do in a state that has so few resources. And so our House Health Care Committee will continue to look at different ways that we can impact that work to help lower costs. And again, we don't have the answers right now in education transformation. We're regrouping, but that will be another place that we spend a significant amount of time. So I feel like, yeah, let's just open it up for questions, and happy to go from there. Thanks.
Hello. I'm so glad that you're on the housing committee. That's something that I'm really interested in. And I guess I have two questions that are related, even though they might not sound like they're related. So we have an unhoused population here in Burlington, you both know about, that is not being housed because all the shelter space is full. We also have a state office building that is just completely empty, sitting right next to the bus station downtown. I have talked to as many people as I can about this, and the answer I keep getting is it's unsafe. It's structurally unsafe. You can't put people in there. But there's no way it's less safe than letting them sleep outside, right? Like, I keep thinking that. Like, I'm like, these people are sleeping in sub-zero conditions, and the answer I keep getting is that it's actually more unsafe for them to sleep inside a building that is still standing, as far as I can tell. So I'd love an answer on that. Like, what exactly is unsafe about the building? Why can't we use it? Because it's just empty. I guess the other question I have, which is sort of vaguely related, is I'm curious about the state of Vermont's eminent domain laws, because we have landlords in the city who have left property vacant for like going on 25 years in some cases. And once again, when I ask like city officials about this, they're like, well, we can't do anything about it because of state law. And I'm like, well, who can do something about it? Like, can Governor Scott be like hippity-hoppity at city property? Like, can he take because they're not doing anything with it. And they're relying on, I mean, it's unconscionable when we have unhoused people in the city that there are rich landlords who are just sitting on. And I work for the Peace and Justice Center. We lead like a cleanup crew around town on Thursday mornings. The vast majority of the litter we're picking up and the needles we're picking up are on these same. I mean, we know who the landlords are. We know who the landlords are, and we know exactly what to expect when we see their properties. And I'm just wondering, like, who can do something about, like, I don't know. So that's, I guess those are my questions.
Okay, so great question. So in the old office building on Cherry Street, The issues with the building is that the parking lot has been slowly collapsing in, and pieces of the ceiling have been literally falling to the ground. I don't know right now, I couldn't tell you like how that would impact floors 1, 2, 3, 4, but I have been in there and it's scary and not safe. And I've actually seen state employees' cars that have like roofs that are like bent from pieces of the ceiling falling in. So I'm assuming that there's some serious liability issues of having people housed in there that if something were to happen, we don't want to create another place where someone goes for a safe place and then something happens. I don't know all the details of it, but I have seen the parking garage and it is a nightmare. You could film a horror movie in there. So I think our goal in the legislature is to continue our work to figure out how we can create more supportive housing for those who are unhoused. And Governor Scott has vetoed our bill twice. And we haven't been able to deal with the override votes on that because we don't have the votes. And so coming into this session, I am coming from a place of what can we pass to make progress? Like at this point, we just need help. Towns need help. And so what are the barriers? And if it's about money, which it is, we're going to have a tough conversation about it. But I can tell you that us, like in the House, and I'm sure the Senate too, remain committed to having this conversation again and figuring out how we can best support towns across the state with an unhoused program. But the governor has been pretty adamant about wanting to spend less money, and that's been our challenge. In terms of vacant housing, I have actually been talking with our chair of our General and Housing Committee about some opportunities for us to do some work to provide incentives to get those sold and back into opportunities where we can rehab those houses and get them in the market. I couldn't tell you the details of eminent domain and how that works, but it has been it's at this point, given all the work that we've done on housing and all the things that we've created to help, this is on the list of places where we could do more, and we know we could do more. So you're going to see some work on that this session. And I don't know if you have anything you want to add to that.
Only that same thing. I've seen it on lists. Very clearly, the Housing Committee is going to be working on that issue, both incentives to get those properties moving, right, and also some sticks to say, okay, if you're not, what are the penalties in terms of tax or fees or whatever, or maybe the ultimate. So a lot of those are more city. It's a matter of kind of what can the state empower the city to be able to do. But we'll be learning a lot more about that come January, I'd say. And on the issue of shelter capacity and fund, we are in a situation where we have worked really hard in the House and Senate to stand up programs and provide more funding, and we have an unwilling governor, and that's a real problem. So. I'll just name that, which is that he has vetoed bills 2 years in a row and has provided no ideas himself. So.
I also have kind of a question and a comment. I know you two have spoken a lot about the budget, and I've spent a lot of time in the State House. I know it's extremely stressful, and there's simply just not enough money really to, fix all of our issues. I do know that there's a lot of discussion about a new women's prison that would be very, very expensive. And I just want to say, as a Burlington resident, who also I go around with the cleanup crew, I'm seeing a lot of the quote-unquote crime people are talking about, at least in Burlington. I want to really emphasize a new prison is not the solution. I understand, I know there was a tour of the Chinton Correctional Facility. I know it's not good. I understand that. The answer is not a new prison. I understand, it's whatever, it's complex, but I highly suggest, do not just listen to these prison developers. There are so many other resources out there that back, a prison is not a place where people are rehabilitated in a good way. I really wish, I'm not sure, Representative Duke, if you got to see the presentation before yours, but there are so many other answers before prison that are much more rehabilitative. My good friend Brooke McKean made a documentary about the women's prison and the history of the current women's prison, and funny enough, I know they're talking about having an extremely progressive new prison. Number one, that is not possible, and number two, if you look, when the prison that we have was being built, that's actually exactly what they said about the one that's being built now. Or I mean, the one that's here now. They said it was going to be different. They said it was going to be progressive. They said it was going to be like nothing the country has ever seen before, that Vermont's doing something new. That's not what happened. It's a really dark place. People that work there will tell you that. You folks have seen it, and people that have to live there have seen it. And the people that are there now, a majority of them actually don't need to be there. It's a housing issue. They don't have anywhere to go, and that's the issue. And they have to stay there because they have nowhere to go after prison. So I just want to plug that as you're looking at the budget. Please do not spend, I think the last quote I read was something like $90 million, where I know for a fact that $1 million could go so far in so many of our Vermont nonprofits. Like, I would like to talk to you after just to share the name of this documentary. It's about an hour, and it's a really good watch. It interviews a lot of Vermont nonprofits that I just, they're really too busy to kind of do this stuff, but it's a really comprehensive look that you might not get otherwise. Sorry for taking so much time.
While we're on this topic, maybe I could share an alternative. So this year I was recruited to be a 2025, yeah? Oh, I'm sorry, thank you. I'm Representative Brian Chena. Thank you, Speaker, for reminding me that people might be like, who's this random person who walked up here? Representative Brian Chena from Chittenden 15, which is part of the Old North End and most of the East District of Burlington. And this is my 10th year, and I serve on the House Healthcare Committee and on the House Ethics Panel. And I was recruited this year to be a 2025 Opioid Policy Fellow by the National Conference of State Legislators, and I'm currently finalizing my recommendations. One of them is related to this topic. Vermont is renowned for the hub and spoke model, as well as for our recovery centers nationwide. In fact, people view us as one of the best in the country when it comes to addressing the polysubstance pandemic, and just think about how bad it is here. Well, it's worse most other places right now on Earth. And we have a long way to go, but I believe that if we build on our strengths, we could really be the premier place on Earth for how we address this global pandemic. And one of these ideas is building on the success of our hub and spoke model, which is medication-assisted treatment that is delivered out of clinics, and then the spokes are primary care offices, by creating what I'm calling a justice and recovery hub and spoke model. So what we would do is, in New York City, they're closing Rikers Island, and they're doing this by building detention dormitories as a alternative to county jails. So every borough is redeveloping the areas around their courthouses and building dormitories for people who are detained or in reentry, instead of putting people who aren't even guilty in prison, and is giving a place for people to transition when they're coming out of incarceration. And so I think Vermont I'm proposing that Vermont, instead of building a new 250-bed Nordic-style prison in Essex, that we instead build a 200-bed detention and reentry dormitory in Burlington next to the Costello Courthouse on the state land that's not used. And I'm working on the design of a 12-story building. It would be the tallest building in Vermont. It would be called the Recovery Tower, and it would create 200 beds for both men and women. It would allow us, by freeing up the detention, because so in the process of law, we have to have a place for people when they're detained. That's part of due process. If you're arrested and you have to be held back till you go to court, you have to be somewhere. And sometimes you can be home, and sometimes the judge orders that you can't. So right now you just go to prison besides the people who are incarcerated, and you're punished even if you're not guilty yet. So instead, it would be a dormitory with varying levels of security. Some of it would be very low security, like you're protected from people coming in and hurting you, but you can come and go as you please. And some levels, you would be not allowed to leave because you pose a risk to self or others. So the building would be structured like a dorm, where everyone would get their own bedroom and their own bathroom, and there'd be varying degrees of security on the different floors. The community services would wrap this facility. So we would have all the existing community-based services people having access to in the facility. People could go to work from this facility. So that means when you're transitioning back from incarceration, you could live in downtown Burlington in essentially an apartment building that's got varying degrees of security, 2 blocks from the transit hub. And then the spokes would be recovery housing built along the transit hubs. So we would build a massive amount of housing for justice-involved individuals along the transit hubs of Chittenden County. So instead of building a 250-bed facility in Essex, we'd build a 200-bed facility in Burlington and hundreds of units of housing throughout Chittenden County. And it would also, the design I'm making also includes 82 beds of supportive housing for DCF youth to live in, so that instead of them transitioning to homelessness, which happens now a lot, they would have a place to live and save up money to get a down payment for a home by the time they're 26. There'd be housing for mothers to move into with their children so that they could be reunited, and then there would be 10 storefronts facing the streets of Burlington, modeled on historic buildings that were torn down by the original redevelopment. So we would honor the neighborhood that used to be there by creating a streetscape that looks historic with the tallest building in Vermont rising out of it, and then it would have an observation deck. We can talk more about that later, but it's a way for the community to have a benefit and also to make money to help subsidize the project. And essentially, what I'm proposing is that we create, as a pilot project in Chittenden County, an alternative to incarceration. It's detention dormitory, reentry dormitory, supportive housing, businesses, a new firehouse is part of this redevelopment because we need a new firehouse downtown, and then recovery housing along the transit hub, the spokes, and then for the women who have sentences, we would build secure recovery residences. We already have one in Essex for people who are justice involved with mental illness. So like maybe 3 or 4 20-bed apartment buildings around Chittenden County with varying security for those women. If we did this, we could move all of the men home from out of state. And that would recuperate $41 million every 2 years or so, every 2 to 3 years, that could pay off this project. And so this is just an idea. And the bill that I'm going to be bringing forward is a study. So it would be a year-long study to engage the neighborhoods around the facility, to assess the need. But ultimately, instead of building another prison that's fancier, I think we need to think differently, and that the building should be designed as a dormitory, because then someday it could just be a dormitory. It could just be housing. So it should be built to be housing, not to be a prison. So I'm just sharing that. I'm open to feedback, and I'm going to be seeking feedback. I'll be coming, or I want to cut myself off now because I probably just spoke for 7 minutes on this thing. But I think it's important for people to hear that we can imagine a different way. And we can do it in a way that, like this recovery hub, it's not just about recovery from addiction. It's about economic recovery in a downtown that's been blighted and harmed. It's about social recovery. It's about rebuilding the neighborhoods around this facility and giving, like, Burlington and Vermont something to be proud of. And someday we could look back and say the tallest building in Vermont isn't a luxury apartment building. It's the recovery tower. And it has a beacon of hope on it that, like, spins around 24/7, like when you go into Montreal and there's that light that spins, to be like this memorial to this moment in history when we woke up and we realized that we can hold people accountable and take care of them, and that punishing people just perpetuates state violence. So I'll stop there with this. That's one of my many recommendations, so we can talk about the others another time.
Thank you.
Thank you, Brian. I have a couple of quick thoughts about that, and then I have another quick question. So most of the people who are incarcerated in this country, it's a for-profit business in this country. There are more people per capita than anywhere else in the world. So it's large companies that own these prisons and want them to be filled. And I have a really good friend who works at the women's prison here, and I asked her one time how many of those women she thought should actually be incarcerated, and she said one. One of them she felt was truly a danger to other people. But it's folks who are low income. There's a really high rate of illiteracy that's in there. It's a racist system, so it hugely needs to change, according to me. That's just my opinion about that. And so unrelated to that, my question is, I keep wondering this, why is the health insurance rate so much higher in Vermont than in any other state? I don't understand that. Thank you.
Okay. Thank you for the question. We could talk all night about this and probably another 2 months. So I think we each probably could speak to some of this. I'm gonna start with the cost of prescription drugs. So hospitals had kind of sort of free range in a way to set what their prescription drug costs would be out of the hospital. And when we came into session last year, we were talking a lot about consumer protection and healthcare and what we could do to help lower the rates. Because there's prescription drugs, there's hospitals, there's all the things, right? And it's not also, it's affordability and access, right? It's those two things. And when we started digging into it, the amount that Vermonters were paying for prescription drugs was way higher than any other state, and we looked into it. And we took action to say, you can't do that, and we began to regulate it a little bit more. It's very complicated, but what I will say is we identified prescription drug cost, huge problem. What can we do to solve it? And we passed a bill to do that, and the governor signed it. It became law, and it's going into effect. We are going to see the outcomes of that, and people are going to start seeing changes in their drug costs. But that now we're hearing from hospitals saying, well, you took that money to save money, and now we're struggling. I think it was the right thing to do. I think it had to be done. I don't think we can count on the federal government to come in and figure out how to lower drug costs. I don't think Trump's drug business is going to fix anything. We need systemic change and what we can do here. And that was one thing that we could do to make a difference to lower cost. And we are 100% committed to coming back in January to say, okay, we've done these things. What's left that we can do in our jurisdiction in Vermont to help lower cost and increase access? And that's our mission coming into this next session.
So why are health insurance prices so expensive in Vermont? I think, so my understanding is there's a whole bunch of things involved. One is demographics. One is economy of scale. We have 650,000 people. Another is a lack of competition. We have one dominant player, which is the UVM Med Center and the UVM network. And another is policy decisions that we have made over the past 30 years with the very best of intentions, but that ultimately drive up prices. I think it's all of those things, and a couple of things I know that we did last year that are helping, to add on to what Jill was talking about. One is we've increased the threshold in which a certificate of need is needed for a healthcare location. So, for example, if you're a healthcare provider and you want to put in a new clinic, you want to put in a surgery center or something like that, you have to get a certificate of need to be able to do that. It's a significant and cumbersome process, and we raised the level of which before that is triggered. So the idea being that can help increase some competition. Another thing we did is we've empowered the Green Mountain Care Board with some more tools to be able to regulate the healthcare providers so that they will spend less money and ideally charge less money. Our hospitals, I can't remember, Brian I'm sure knows, is one of the most expensive hospitals in the country. Why is that? You know, I think there's probably a lot of reasons for it, but one is that they can, you know, and they've been on kind of this sort of empire building mode for the last number of years, and I think thought they needed more money. So the Green Mountain Care Board is kind of flexing their muscle more, and we've seen a lot of changes in the hospital just in the last few months. Sonny Eapen stepped down. Dr. Leffler is now in charge, and he is very community-minded, and I think making some really good changes, and is already reducing the budget of the hospital. But I think we also have to realize that we have, as a community, have decided to do things that have increased the price of healthcare. 25 years ago, we were one of the lowest cost healthcare systems in the country, and now we're one of the most expensive. So, you know, I think it's all of those things. I'll give you an example of a policy decision. I think it was in the 90s when Vermont, now I've forgotten the term, it's community rating. Yeah, it's when Vermont adopted community rating. That means everybody pays the same for health insurance, regardless of your age, regardless of your health status. And so so that is important in terms of we want everybody to be able to have access to health care and to have access to health insurance. However, one of the results of that is, so in many states, it is, I can't remember what it's called, but it's the kind of rating where basically a health insurance company, it's kind of like life insurance. They will decide how much you're going to pay based on your age and your demographic and probably some pre-existing conditions. So what happens in Vermont is many of our employers are now self-insured, because if you're self-insured, let's say you have 100 employees and they're, you know, healthy, maybe they're on the younger side, and as an employer you might say, you know something, I will spend less if I am a self-insured entity, which means they're now no longer in our insurance pool. They are essentially paying for you know, if you're an employee and you go to the doctor, then, you know, this self-insurance pays for that. So what that means is we have fewer people in the insurance pool, and those people tend to be people with whose health care is more expensive, and that drives up the insurance prices. So yes, so the state, because of our demographics, we are skewing older, which means higher health care needs. And many of our younger people work for companies where they're self-insured, and then those people are not in that health insurance pool. I think we have the strictest community rating rules in the nation. So that, you know, that's just a piece. I'm not saying it's good or bad. I'm just saying that's just one of many pieces, I think, that have resulted in our really high health insurance premiums.
Yeah, just what I might add is I think a lot of the problems go back to the Affordable Care Act, that when President Obama proposed that we have universal health care in the United States, there was major pushback from the insurance companies, and trying not to make it a partisan thing, but the people in power in Washington kind of gave in to those insurance companies, and they created an Affordable Care Act which protected us in many ways. It said that we all are guaranteed insurance regardless of pre-existing conditions, and that there would be these marketplaces and subsidies in place so that we can all have access to care. But then there was a mandate that we had to purchase health insurance, a federal mandate, you know, and the Supreme Court even ruled that that was allowed because it was a form of a tax. And the Chief Justice Roberts said, yeah, this is allowed. The government's allowed to tax you. This is a tax, and this is the consequence of your choices for electing these people who now are forcing you to buy health care. And then in Vermont, I got elected in 2017, and Trump also came into office then, so we quickly, and I think rightfully, put all these protections in place in Vermont so that if they eroded the Affordable Care Act, people wouldn't suddenly have the floor drop out from under them. But we also failed to follow through on Act 48. So Vermont got a waiver from the Obama administration to implement universal health care in Vermont, and the Governor Shumlin at the time, and you know, the Speaker was in the House, so you can maybe share more from personal experience about the dynamics, but he kind of changed his mind and the political will went away, and Vermont, instead of following through on universal health care, decided to instead sort of pull the plug on full universal health care, but try to fulfill many of the principles of universal health care, and one of those was to have the Green Mountain Care Board regulate the cost, but we never gave them the teeth. So for many years, they're like weighing in on things and on the cost of plans, but they couldn't regulate the cost of care. And so what happened since 2017 to now is, and I'm gonna name names, the UVM Health Network ate up primary care practices and hospitals around the state and upstate New York, built an empire, which has been referred to here, and then proceeded to overcharge for treatment. Like an example is like a $7 cancer medication charging $700. And then and justification being, well, the patient only is going to pay 10 grand for their deductible is 10 grand. So the patient's not paying it, the insurance company is. But what that means is then the insurance companies have to raise their rates because of that inflation of price. And then where that money went was to bonuses for multi-million-dollar paid executives and a huge bloated administration at UVM, and to prop up hospitals in New York State that were failing. So they took Vermont taxpayer and ratepayer money and used it to keep open hospitals in another state while giving their executives bonuses, and there was nothing we could do about it until recently. Last year, we passed regulation that created a hospital monitor who's now tracking UVM spending and like basically looking over their shoulder to make sure that they follow the rules and that they don't do this. And we gave the Green Mountain Care Board the power to set prices, and that was huge. So it's called reference-based pricing, and we're gonna be getting some reports back like in a few days even, I think it's coming soon, on how to implement this. But in other states, the teachers' unions actually were the ones championing this for their plans. This approach to regulating cost recuperated double-digit millions of dollars a year. So our hope is that this approach to cost will recuperate money within our system that we can then reinvest into the system. The problem is that that's only one piece of the Jenga puzzle, and the federal government has just pulled out all the pins. Like I just saw on the news, I was just at a foster home, and I'm sorry I was late. And on the TV, while we're talking about all the problems people are dealing with and their taxes going up, we see that the Senate failed in DC to extend our subsidies, which means folks like myself, I purchase my insurance as a healthcare provider from the exchange, an $800 plan, I only have to pay 16 cents for because I make so little, because I get a tax credit. So I'm not getting a handout, I'm just not paying taxes. Or I'm paying, I can't explain it well, but it's basically like I'm not paying, instead of paying taxes and paying for the health care, part of my tax burden is the healthcare advocate should come here and explain this to y'all because he's really good at it. The point is, I have a choice that I have to make by December 15th. Do I pay $800 a month for a healthcare plan that I can't afford to use, or do I say forget it finally? But the problem is, every single person like me who leaves means the next year the price is going to go up even more. So we are going to be on a downward spiral, and I don't think we have the money in Vermont, even if we tax the wealthiest people more, to fill that hole with all the other holes we have to fill. So we really need to think about how we deliver health care very differently. Luckily, we've been studying that. So we passed a bill last year. We're going to be getting reports back soon on the delivery and finance of health care around the state and how to realign it. But in the meantime, we're hearing about Copley Hospital closing their birthing center, UVM's threatening to close mental health units. UVM terminated its contract with the Howard Center for assessing people in the emergency room. So now only their psychiatrists decide who gets what happens. And what we're hearing on the streets is unhoused people being no trespassed from the emergency room after going there from almost freezing to death. So now where do they go when they're freezing to death and there's no shelter? And so things are really falling apart, to be honest, and I don't know what we're gonna do. But I am committed to working with my colleagues to see what we can do to salvage our healthcare system. But we really need to rethink the whole system right now, and that's not even talking about Medicaid and Medicare, and the cuts there, because Vermont looked at the House. We proposed in my opinion, a small tax on hedge funds and corporations. that would allow us to then draw down money from DC to extend Medicare to like 60,000 elders who like are starving, like that's how poor they are. And the Senate like eliminated that, wouldn't do it. Our Vermont Senate, it wasn't even the governor. So I just don't know, I think your question though about what's driving the cost, I think I answered some of it, but there's a lot more than even what we said. There's many factors, and we're trying to get a handle on it, but ultimately my summarizing statement would be that we've built a healthcare system in a society that is completely unsustainable. And after 200 and something years, we're finally paying for it. And we're gonna have to rethink how we live on this earth.
So I think you're probably hearing the theme here of what this next legislative session is going to be for us, right? So we're having substantial cuts from the federal government. So like almost a third of our state's budget is federal funds, and that's going away. While at the same time trying to figure out how we can increase access and lower costs for healthcare, how we can increase access to affordable housing, at a time when the tariffs are going up and workforce is going down. So just building is more expensive, and we want to invest in that, but that's another cost factor, right? And then we are concerned about public safety in the prisons at the same time that we have ICE putting more people into our system. And so I think what's really going to be important this legislative session is for us to make sure that we're communicating very well with you about the decision points that we have to make. And we need to hear from you on like how are you feeling about this? Because, do we have a conversation about raising taxes to cover these things? And if so, what are those taxes and what do they pay for? Or if folks, because I'm getting a ton of email saying, don't raise taxes, I'm being taxed out, it's too expensive. So that means, okay, if that is where we are, what do we cut to support basic functions of government, and how do we do that? We can't do that without your feedback. So, we're going to be back here during the legislative session to get your input, but I can't stress enough how important it is that you're sending us your thoughts and feedback, because this session is going to be 4.5 months long. We're going to get more things from DC that impact our budget and that we're going to have to deal with. And we have a governor who doesn't always agree with the legislature's approach, who could veto something, and we don't have the votes to override. And I personally, I'm not speaking, for the entire House, but I'm just saying, I think that we have to do something that delivers for Vermonters this session. Like, I don't think like us debating a veto is going to help anyone. Like, I need you to have more affordable health care. I need you to be able to afford living in your apartment. And these are going to be really tough decisions. So we need to figure this out together and make sure that we're making progress this session.
Oh, just one more thing about the taxing. I want to be clear, I support increasing taxes only for those at the top. That at this point, I would love to see for us to find a way to recuperate the Trump tax breaks, which are record level tax breaks for those at the top in Vermont, and use that to lower taxes for everyone else. I think it's possible, but I don't think the political will is there, because to be honest, not only the governor, but a lot of the legislature is afraid of that. It may not be us, but a lot of our colleagues are afraid of and an example, like I said in a vote explanation, Madam Speaker, read my lips. Yes, new taxes on corporations so that Vermont can extend the health care to all Vermonters. And the Republican conservative news outlets quoted me as saying, Madam Speaker, read my lips, yes, new taxes. And to this day, they continue to lie and say that I want to tax everyone. So for the record, I do not want to tax probably anyone here. If you make more than $500,000 a year, yes, I want to tax you a little bit more, okay?
So I think yes, and, we're a state of 650,000 people. We have there are just over 1,000 tax returns a year in which the adjusted gross income is more than $1 million. There's about 2,300 more that are between $500,000 and $1 million. So the reality of we are not taxing, even if we're taxing the well, we are not going to be able to tax our way out of this. That is, we are not a place that, Massachusetts has 27,000 people who have an adjusted gross income of more than $1 million. We have to remember our scale and what is realistic. We're also a state that has high business costs. So it is just something we always have to pay attention to. If we're raising taxes on corporations, we need to really understand what are unintended consequences to that. Our cost of labor and our cost of real estate is higher than most any other state. So, I'm just saying that those are the things we have to consider. We always have to consider what are we doing, why, and what are the unintended consequences, and then is it worth it?
So let me just weigh in right now and say I want you to tax whatever small number of people are making over $500,000, because we need to have a whole change in that paradigm. If it doesn't solve the whole problem, that's just the way it is, but it is a message, and it is real money. I'm sorry, it's gonna be real money. But that's not why I'm doing this here. I want to know, well, I wanna just say for everybody that we have 5 charter changes that have been stuck in the legislature. The no guns in bars was passed by 90%. The redistricting, which is a no-brainer to me, which has been stuck down there, which says that the city of Burlington shouldn't have to go to Montpelier to make sure that to tell us that we are okay to divide wards 2 and 3 on North Street, right? As if somebody in Newport or Bennington should have any right to say that, and that's been stuck down there. Just cause eviction passed with between 63 and 68%. And we have a housing crisis, Kaysen said this, that is outrageous, and people are getting outrageous rent increases and getting thrown out for nothing so that landlords can profiteer. And that has been stuck down there. And there's a notice provision that we voted for, again, by about 68% of the vote, maybe it was 65 also, that says that you got to give more notice to people for evictions and for rent increases, because the housing market here is outrageously tight, and 3 months is just not sufficient. And there is one more that I am forgetting, because there are 5 down there. And the truth is, as somebody who advocated for them and was on the charter change committee and got them passed, I don't actually care if the governor vetoes them, right? Because he doesn't have to veto them now, because they're just sitting on the wall. And I want him to be held accountable, because everybody here in the city of Burlington should know that, and he should get like 1% of the vote, because that's all the people that he's representing, right? And if there are legislators who are not supporting it and they're going to vote it down, then I want them on record. You know, the Republicans did a really good job since probably the late 1970s of really closing what is acceptable in our country for politics. They go after taxes so that Grover Nyquist can say, I want to shrink government to the size that I can drown it in a bathtub, and now the bastards are doing it. And sometimes, and they lost for years. I can win even when I lose, because the people get exposed and the issues get raised, and then we get a chance to say to people, there's a change that's gonna come, and we're gonna have to make it happen. And that's what I want. So I am sort of, because I've had a long day and I'm now hyper on this, so excuse me, because I'm sort of channeling Brian and his enthusiasm. I personally want the legislature to move those charter changes that the people of Burlington voted overwhelmingly, and demand that the legislature at least act and give us the common courtesy and decency to do something about. And the city council, just so everybody knows, voted unanimously in that way. And we'll be meeting tomorrow at the legislative breakfast. But it's really important, I think, for people to know that we have asked for specific legislation for Burlington overwhelmingly. And in my opinion, the legislature is failing us. So I would like you to push that through, Madam Speaker.
Thanks, Jean. And I totally hear you, and I just respectfully disagree. We actually have passed some of those charter changes. The governor vetoed them. We tried an override, and they failed. So I just want to be clear that we have passed some of those out of the House, and we couldn't override the governor's veto because of the high threshold. So we are a Dillon state, which means that the legislature has to approve charter changes of like what local towns and municipalities want to change. So that's a whole separate conversation if we want to go to someday of like whether we should do that or not. But that's where we are right now. So in the past 5 years, we've passed 11 of Burlington's charter changes. So I just want to be clear that there are charter changes that are moving. And some of these sticky ones are the ones where they have been vetoed or we don't have the votes out of a committee. So the question is, how much do you want us to try to compromise to pass something that has some result, or do you want us just to have a vote and have it fail? And that's where we are right now. So I'm looking forward to having the conversation. I've reached out to the mayor for a meeting. I want to know, do we want to keep on trying to compromise to find something that passes, or do we want to hold the vote right now to say, well, we don't have the votes and it fails? I will say, some people will tell me, Jill, you're not being aggressive enough. You need to twist arms and you need to tell people if you're not going to vote yes, you should be kicked off of a committee, or you're going to pay some consequences for voting against this. And I'm just going to be clear, that's not how I govern and that's not how I'm going to act. I feel like that's pretty Trumpy to be like, if you're not going to vote for something, you're going to be punished for it. And I know it's frustrating. It's frustrating to be here, to be like, how are we keep on having these votes and people are voting no? But this is the Vermont legislature and people are representing their constituents. And I'll tell you, gun votes in the House and in the Senate, very tricky, very difficult, many vetoes, many tough, long debates in the House and Senate. So I guess, I would welcome conversations. Please reach out to me what your opinion is. Do we have something die in committee because we don't have the votes and just end it? Or do you want me to keep on trying to find a compromise forward? And that's where we are. And it's not great, but that's where we are in this body. And that's where we are because of the way that our government is set up, because we're a Dillon's rule state. And it has pros and it has cons. But that's where we are working right now. And I will just say to our city councilor friends here, please, I know we're talking here, and I love that you're showing up and asking questions. Don't hesitate to reach out to us at any time. I would gladly sit down with you at any point to talk these through. So thank you, Jane.
Milo, I'm sorry, this will be really quick. I just would like to say, as a young person, I understand that governing is hard. I know your job is hard. I have to say, though, with the way our federal government looks right now, it is so frustrating, frankly, to hear you say, the compromising thing. I get it, but I think, the Democrats failed miserably this last year in Vermont and, more broadly because of that sentiment right there. It doesn't feel like, I hear you. Do we put it to a vote and fail, or do we compromise? But there needs to be some sort of new idea, some sort of middle ground where I'm not feeling like the Democrats are really fighting for people anymore. And I do worry also that sometimes the Burlington representatives are not fighting specifically for Burlington. I'm a Vermonter. I grew up in southern Vermont. Vermont issues are very important to me, but I live here now, and there are some really serious issues that the rest of Vermont doesn't understand. So I guess twofold, I want to feel like as a Burlingtonian, you're fighting for me, and as a Democrat, we gotta see something different other than, I don't know, it's really hard.
I would love to sit down with you and talk about this, because seriously, I know we don't have much time left, but we have done a lot for Burlington in the legislature, and I hope and I want you to feel that. Like, we invested in this new high school downtown. We invested in public safety. We are doing everything we can, and I know it doesn't feel like enough, but when it comes to support systems for the unhoused, for public safety, so many things we have done. We just passed this last legislative session, some changes to encourage and make sure that the housing development in the South End happens, because we need more housing in Burlington. So many of the housing projects you see in Burlington have state investments in them. Just where the old VFW was, like all over this city. So I think the question is, what are the priorities? Like, what are the priorities for us in a really tough environment where we don't have a lot of money? What is the best return on investment for Burlington right now? And that's what we need to hear from you. And I will tell you, Burlington is not alone in this fight. As I travel around the state, we have kids that are not getting a good education, that live 15 miles from someone else who's getting no access to AP courses, to sports. You go around Brattleboro, same thing with the unhoused. They are begging the state for money to help them. So I know that we are feeling the pressure right here in Burlington, but I sadly share that we have struggles all across the state, and everyone is feeling it. So I think it's important that we're working together to fight for each other, to make sure every community has what they need to get ahead. And it's really tough right now, but we're committed.
Okay. I've been talking a lot about this before, and I echo some of the sentiments that were just mentioned. I have had my frustration with the overall Chittenden County delegation, because the past couple of years I felt in particular that they didn't seem to be unified in the understanding of the issues that were occurring in Burlington and how they were also going to be affecting other towns in Chittenden County. There is drug trafficking across Chittenden County. We are the epicenter, but it is happening. There are arrests, there are crimes, it's all related. Rutland, Barry, Northeast Kingdom, it's happening everywhere. And there's been a real failure to listen and to understand, and things are getting away from us. That's just a fact. I do feel that you have to be more aggressive, but not in the way that you described. There has to be a way to change the course of the conversations. Like, we can't get through our redistricting. Like, what, I just feel that for these things that are languishing, what is it? I mean, I feel like when you say, oh, things could be Trumpy, things are Trumpy right now. They're really, really Trumpy. A lot of us see that coming from state government with regards to how people vote and how they feel about Burlington. You know, the constant joking that Burlington's not a part of Vermont, right? We hear that. Where people are denying us the right to our own governance, right? That's kind of a violation of how some of the more conservative legislators feel, right? Because some of them care about self-governance. They claim that's what they believe in, but that's not how they're acting. So how do we have the conversations to get them more to the point where we're actually asking you to govern the way you claim you want to govern? And I think also calling out some of the discrimination, some of the racism, the resignation of Senator Douglas, that revealed a lot. That guy was recommended by the governor, for God's sake. You can't say the governor doesn't know what's going on. You can't. And that makes me a black woman who's lived here for over 40 years. That makes me a black woman who represents a very diverse group of people, economically, in addition to racially and how we identify with our gender and our sexuality. We are the most diverse area, and there's something that scares some of those other legislatures.
And the text message scandal that Senator Douglas was involved in, which he knew what was there. Come on, we're not stupid. And they said they were kids, and one of the people in the text was like 40. So I think we need to start to really be direct with some of these individuals in how they think. And there should be some things that we don't necessarily compromise on. We see where we're at with the subsidies, right? There was never going to be a compromise. I don't want to rant any longer, but I just think that the definition of insanity is doing the same thing over and over again without any change. And we have to think differently about how we rally the rest of the legislature to support Chittenden County and to support Burlington when we're the economic drivers in this state. Thank you.
So I just want to take a moment to validate what I'm hearing about the anti-Burlington sentiment, and it's real. And if you could hear some of the microaggressions that I experienced there from people about me and my constituents and those people in the Old North End and those people downtown, and it's horrific. And there is a lot of hypocrisy. We have the governor standing up there regularly in his State of the State speeches, like demonizing Burlington, and like he'll praise people in a rural town for giving out lemonade after a flood, but has yet to acknowledge the heroic mutual aid efforts in this city that are just keep growing. I don't know how many nights a week we're feeding people now and how many days. And in addition to what the churches are doing and what the social service providers are doing, not a word of acknowledgement from this governor about that, but he'll get up and praise a small business in a rural town for giving out free coffee one day after a flood, and have the person gets a standing ovation and is sitting there in the balcony. And so we are regularly demonized and blamed with no acknowledgement to the amount of money that this city is producing and that this county is producing and giving to the state budget. So that's real, and it's really hard to live with it, to be honest. It makes me want to quit sometimes, because I go there and I feel like I have to endure like abuse from other people. And then when I talk to leadership, I'm not going to name names, but I talk to leadership of committees about this, and I'm told, I don't care. Like literally, I don't care about your voters. They're not mine. And I am in power here, and I don't want this personally, so it's not going to happen. I'll tell you all right now, I voted no as a voter on that gun charter change. I was one of the 10%. But when that comes to the floor, I'm going to vote yes, because you approved it. You know what I mean? My personal feeling on that charter change, which I'm happy to explain with you outside of this meeting, is not going to be how I decide when that charter change comes to the floor. Because 90%, if it was 50-50, maybe I'd be like, look, it was like 51 to 49. I mean, why should I side with the 51? It was close. I probably still would. But maybe I would debate it, but 90 to 10, it's undebatable to me. The people of Burlington want this thing that I think is dumb. I'm going to vote yes on it anyway. So the fact that a committee chair or leadership can say they personally disagree with something, so they're not even going to bring it forward for a debate, that's concerning. It's also concerning when people say we don't have the votes and we don't want to have a debate because of it. I think that speaks to Council Member Bergman's point. But I get why we don't want to do that too, because I have to live in that environment. It's painful. It creates all this harm, and then we don't achieve anything, and it undermines our unity when we could be focusing on things we could deliver. So I get that, though. So I want to acknowledge I get that. But it's frustrating when I hear from people that, like, and it's fueled by the governor's rhetoric. So I think, like, we need to acknowledge that the governor has, and the people funding him, have created a narrative of Burlington as some kind of problem. And what's interesting to me, just let me say a little more about this, and then I want this to give you a chance to talk about the hopeful news that you have. That the governor was repeatedly saying horrible things, and our former police chief, who is the public safety commissioner, saying things like the progressives, these progressives are getting what they deserve. You know, they want to tolerate drug use. Well, too bad. You can deal with people overdosing. You can. I heard that one of the members of the administration said in a meeting when I was recommending that we create like creative shelter and housing. I have an idea. Let's just kick them out of the motels and send them to his district. Ha ha ha. What happened? Where are they? You know, so it's like punishing us, you know, almost like punishing us for standing up for our people. And then demonizing us, like, oh, these progressives don't want the police to be, the progressives want community control of the police. Heaven forbid they answer to the people they serve. How dare they, question the police? Let's hold back funding and create social conditions that drive criminal behavior, and then blame people for questioning the behavior of the police for that. So like it's a gaslighting us, like saying it's our fault for questioning state violence and perpetuating more state violence on us, and saying it's our own fault. And then the governor even said recently, before his sudden turnaround, he said, Burlington made its bed, now they can lie in it. It was in a press conference. That's a quote. Then a few select business owners meet with him, I don't know who they were, and then days later, the tune changes. I'm gonna clean up Burlington. And he sends the state police in, at least they're not the National Guard, right? He sends the state police in, and God bless them. I haven't seen them do anything wrong, okay? So this is not anti-police, but it's a waste of the resources. They're just walking around town. They're literally picking up trash. God bless them, But like, where's the governor? He said, I'm going to come clean up Needles. Have you seen him cleaning up Needles yet? I haven't. You're the ones doing it, right? He hasn't come and cleaned up anything. So, he might be signaling now that he cares about us, but it's only because the wealthiest people in Burlington got mad that their businesses were being affected and their property values were being affected. And God bless them for saying something, because it made a difference, a slight difference. But I just want to put this out there that the anti-Burlington sentiment is real. When the people of Burlington advocate for what we need, instead of us being heard, we're punished when it goes against the interests of those with the greatest power and wealth in the state. It goes against it so much that if you look at campaign finance reports, that the people who used to fund the Democrats funded the Republicans in key districts around this state and lied about people's voting records. I'm going to say Catherine Sims. She voted for her constituents, and they lied about her in ads and got away with it and beat her with Douglas. So, so I'm just putting it out there that it's real, and like, as much as we fight, we are up against a steep curve. And if there's anything you can all do in Burlington, it would be stop voting for Governor Scott. So I'm going to hand it off to the speaker because you have some good news.
Right, I feel. We've covered a lot tonight. And okay, can you? So yes, we've covered a lot tonight, and I know we're over time, but in my response to Jean, I wanted to make sure that it got clear, because I don't think I said this, is that the redistricting charter change will be taken up in the House Government Operations and Military Committee. That's going to be the first Burlington charter change that they do look at. So I don't think that's controversial. I feel like that is a good start to get us going. And so that is my good news on charter changes. But I will also say that we are getting a memo of the city of their priorities. And I just want to be clear that charter changes isn't the only thing that the city wants and hopes that the legislature can support on. So we're looking at more support for the unhoused, more support for public safety. And so all of that is a package together. And I know that we're going to be having more conversations about how the state, the legislature can support those requests. So again, we're going to be getting some charter changes across the finish line. And I will just add to what Brian just said. We are seeing more out-of-state money coming in. You talked about in-state donors, but Americans for Prosperity, which is a Kochs brother institute, PAC, has infiltrated our state, and they were here last campaign cycle with mailers and online ads and radio ads. They have not stopped. The postcards are still coming out, the ads are still coming out, and they, believe it or not, are now organizing a legislative welcome back event on January 5th. So I just want you to know that Trump is here now in our campaigns and they are putting money into the state, and they haven't done that in the past. So just need you to know that that is happening here. We have to be aware of it, and we have to fight it. Thank you.
All right, well, a little bit over time, but thank you all for coming. Thank you to our state legislators who also came. And that adjourns our meeting. Thank you very much. Oh, the door prize. Okay. Jesus Christ. What the hell is your playing? Bet Seidler. Yay, Bet. Beth?
Record.